All right, I want to see a show of hands, ladies. Who is confused about the use of masks in public? Anyone? Anyone? Yeah, yeah. I think a lot of us are
Yeah,
there.
kind of,
Well,
yeah.
here's part of the confusion, right? I want to dive in because it is our chief medical public health officer, Dr. Theresa Tam. And it turns out that maybe the tune is changing about the use of non-medical masks in public. Here's what she had to say yesterday about this very topic.
A non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or land on surfaces. Wearing a non-medical mask in the community has not been proven to protect the person wearing it. It is an additional way that you can protect others.
Okay, forever we were told no masks, no masks, no masks. We definitely know no medical masks, but now it turns out maybe you can fashion something at home and go out. Should we now be wearing masks in public?
I haven't been wearing masks when I'm out with the dogs or like the one time a week I go grocery shopping. But I do know that even though the medical community is saying that, like what, Dr. Tam just said in terms of how effective it is, my parents firmly believe in masks. They have had masks for a long time because both are immune compromised, and my mother's in and out of the hospital all the time. So they had a supply of them, and they live in a condo. And there are a lot of people who I've talked to who live in condos, including my parents, and there are a lot of elderly people in the building who believe that one of the advantages of wearing a mask is when you get on the elevator in a condo and then the doors open and someone's waiting to get on and they see you with the mask, it's an immediate reminder, hey, physically distance, or they won't even get in. It's a deterrent for having someone ride the elevator with you. The doors will close and they'll be like, I'll just wait. And that is automatic physical distancing. So effective in that sense.
Wow, that's interesting, Lainey, because there have been times where I am outside, if Simon and I are going for a walk, and I'll see someone on the side of the street and I'll zone out for a second if they're not wearing a mask, and Simon will grab me like, what are you doing 6 feet apart, and pull me over. And you're right, the mask would be a really good sort of mental reminder. I haven't been wearing one simply because I was following the advice of the World Health Organization and Theresa Tam. But now that, Public Health Canada has sort of changed their tune to it couldn't hurt, I am thinking about it. I think also the idea that you sort of go forward by judging the people around you. And in my community, I'd say the majority of people still aren't wearing them. The idea that there is this idea that they do offer a false sense of security. So I think until I see the rest of my community wearing them, I might start wearing a homemade one just because I don't want to make other people nervous. Or if I were taking public transit, I think I would definitely wear one. But from the lifestyle I'm living right now, it's just homebound, really.
I hear you. I'm not wearing one yet either. I am seeing more and more of them in my community, I will say. And I guess the kind of the part of this that sort of bothers me is just that it's been a bit confusing. And, initially there was sort of recommendation to not wear them. And again, she's been very clear, Dr. Tam, saying not medical grade. And people don't always listen very well, though, when they're kind of consuming media, period. And I wonder if this will lead to a rise in people trying to, again, obtain PPE things that are meant for the medical community, and we should not be touching them. And for me, I feel like the efficacy, as we know, of homemade masks is really not it's about protecting the public from you. You're not protecting yourself.
Yes.
And I actually worry that I put myself more at risk because I'm a face toucher, and there is some evidence to suggest that the more people have things on their faces, the more they're going to touch themselves, and then the more they're putting themselves at risk. So I'm not going to personally, I don't think, wear one unless I'm explicitly told to.
Mm-hmm. It's interesting, Sin, because I feel like the people who this might actually help the most are the people who think they might actually be invincible to this and not. get sick, and that might actually be the younger set, because we still see statistically that there's a lot of young people still out and about not thinking that they could have it. And so it turns out, like exactly like you just said, the World Health Organization said wearing a mask, a non-medical mask, means if you have it, you could potentially just stop from you giving it to other people. So if you make it like slightly fashionable, like my uncle is doing, maybe, making it fashionable and meaning you protect other people, it's a win-win. My uncle is actually sewing together old designer shoe bags, washing them, of course, and fashioning them into these like super fancy masks that now his family is wearing, and they're like super, super cool. There's my cousin Tina. So there's a beautiful MCM one.
That's awesome.
Don't forget Karl Lagerfeld. Don't get it twisted.
Oh my
And she's young, and she's the one who knows if she's asymptomatic, she's living with her older parents. This is who it's for. It's for her to not potentially get her parents sick. I love it.
Oh, wow. Okay. Those are absolutely awesome. I love that. So creative as well. For me, language matters. I'm the one member that I was holding on to our vacation cruise until the very last second. And it wasn't until the Prime Minister said, listen, do not travel, that I canceled. I literally canceled on a Friday and was meant to leave the Saturday. So I'm listening to the language. Dr. Tam is saying you can do this as an extra layer of protection, but until Dr. Tam says you must do this, I won't be.
Yeah.
So I'm not wearing masks at present, and neither are members of my family right now.